Okay, so what testing is involved before doing egg freezing? Most of it, actually all of it, is just a blood test. Some clinics will have patients do these tests on cycle day 3, your first day of your cycle being cycle day 1. We don't require it to be cycle day 3 anymore. You can do this testing really whenever. Usually it involves checking your AMH, which is your anti-Mullerian hormone, or what we call our ovarian reserve number, estrogen, follicle stimulating hormone, LH, progesterone. We do check your thyroid. We check some general health things like a CBC, so it's just a cell count, make sure kidneys are working, and something called a metabolic panel. So it's just general blood work with some hormone stuff added in. The other thing that some people may do is an antral follicle count, meaning we put an ultrasound and a transvaginal ultrasound in and kind of look and see what your ovaries are producing. One blood test that I think is really cool, this is kind of optional when you're egg freezing. It's called an expanded genetic carrier screening. And so it's a blood test, and we check you for about 500 different diseases. And chances are you're going to be a carrier of something. But this is something to know down the line when you either have a sperm donor or you pick a partner, that if the sperm is a carrier of any of the same things you are, you would have a 1 in 4 chance of having an affected child. And so down the line, you would know, okay, I need to check my potential partner or donor for this thing. And if, I'm set on this person or this donor, we need to do genetic testing called PGTM for monogenomic or single gene disorders, so that we can make sure that the embryo we transfer is not affected. And so that's a test that's optional, but I think it is really cool to know down the line.